Okay, my name is Jazmin Hampton. I am doing a presentation on headaches. So to start, I just want to talk a little bit about the definition of a headache and the epidemiology surrounding headaches. So headaches are typically pain or irritation that you can feel all over the frontal or the occipital portions of your head, and they can be defined as intracranial or extracranial structures. Typically, people have a lifetime prevalence of over 90% of getting headaches. Females tend to get more headaches than males, and then the most common headaches that usually affect people are tension headaches. However, there are several different types of headaches that one person may get over their lifetime. So now I'm going to briefly discuss the different classifications of headaches. So we broke down primary headaches. There's primary and secondary headaches. First, I'm going to discuss primary headaches. There's four different types: tension, migraine, cluster, and mixed. So tension headaches, they typically are caused by anxiety. They could be caused by lack of sleep or even stress. And they can last from 30 minutes to days. So this is your most typical type of headache that someone may complain of. And oftentimes they may occur occasionally. Some people get daily headaches, and they're typically seen around the frontal portion of a person's head. So people may say that in front of their head hurts or around their eyes. A migraine headache, however, is something that can also be caused by stress, but may also be exacerbated by exertion or hormonal levels. Occasionally, women will say when they're on their menstrual cycle that they have these migraine type headaches, as migraine headaches can present with aura. Aura meaning that there's some sort of precipitating factor that a person may feel before the headache actually comes on. That meaning menstrual cycle, light sensitivity, ringing in the ears, nausea, vomiting. These can last between 4 to 72 hours. And typically they're occasionally, but also can be seen monthly and be tracked, for example, again, with women in their menstrual cycles. And typically it's on one portion of the head. So someone coming in to complain about, a headache that they get once a month and it's only on the left side of their head, typically we would say it's a migraine headache. Next, we have a cluster headache. The biggest trigger for this is alcohol, and these usually last between 15 and 180 minutes. And people can have episodes up to 3 times every 24 hours. And these may present on either one side of the head or kind of periorbital, so having pain within, around, or behind the eyes. And then you have a mixed headache. So a mixed headache is defined as something that combines the triggers, duration, frequency, and localization of all the primary headaches. So some people may one day present with a tension headache, but also that doesn't exclude them from getting a migraine or a cluster headache in the future. So here's a little diagram that I put in just to kind of give a better visual of the types of headaches that you may come across. The first picture is migraine headache. You can see it's over one portion of the face. And then you have the tension headache, which is kind of seen throughout the forehead, and then a cluster, which is a combination of both. For migraine headache, someone may say that it's throbbing and hammering, whereas a tension headache, they might say that it's just dull and kind of like a burning sensation. Secondary headaches are more to rule out before coming up with a diagnosis of a primary headache, whether it's migraine, tension, or a cluster. And these headaches are typically related to other causes and could be more life-threatening. So some of these headaches include meningitis, different types of hemorrhages, hematomas, strokes, trigeminal neuralgia, concussions, and medication overuse. So it's really important to, when you're going through your differential and someone presents to your clinic or in the emergency room, that you're ruling out these more dangerous causes of severe headaches before diagnosing them with a primary cause. So diagnostics and treatment. So when someone comes in presenting with headache-like symptoms, first you want to take their vitals and history and physical exam. The history and physical exam is especially important to see if this is the first time they've ever had a headache or symptoms like this, or if this is a repeated pattern from the past. This will help you first help with the primary versus secondary diagnosis and able to kind of guide your diagnostic pattern and diagnostics for this person going forward. So after the physical exam, you want to determine what you want to do for testing, and that's based on risk stratification. Risk stratification for headaches is in two buckets: low risk versus high risk. For low risk, there's no routine lab testing or imaging. That means you're basically diagnosing this person with the primary headache and giving them medications for as needed for symptoms. And high risk, if you suspect a secondary cause, then you want to do a more extensive diagnostic workup, which includes labs and imaging. So the labs will be based on clinical suspicion. So whether you think it's a hemorrhage or a concussion or some sort of hematoma, you could do CTs versus MRIs versus other lab works, lumbar punctures, etc. And then for treatment, based on the class and diagnosis of concussion that you are giving a person, majority for primary concussions, it's rest, hot and cold compresses, small amounts of caffeine, and then the most common medication is NSAIDs. You can also, for someone who comes in with chronic primary headaches that are very severe, you can give triptans or oxygen therapy. And then for prevention, in some cases, for someone who constantly get those migraines, especially during their menstrual cycle, they can, for prevention, take metoprolol or amitriptyline to kind of prevent the severity of those headaches in the future. The treatment will differ for someone who has a secondary cause for a headache, as then you are now treating not only that new diagnosis, but the headache on top of that. And that's it. Thank
Okay.
you.
Let's see.